Hey guys. I'm really excited about this live tonight. I think it's going to be really good. So, as soon as we get some people. It says we're telling people to join your video, so that's exciting. I'm going to be talking to Korie with Functional Health and Wellness today. And it's going to be really good. Hopefully. I am going to... Hey! Welcome. We'll see if Korie joins us here shortly. Hey, Lindsay. Just getting rolling. Hey. Korie is here. Hey, Christina. So, Korie, there should be a question where it's like, yes, there we go. Request to join. Here she comes. Maybe. Hey!
Oh my gosh, hi!
How's it going?
Good, this works. Okay, so if I go like this, can you still see me? Can you still see me?
You're definitely sideways on my end. I can see you.
Okay, let's see here. Let's try this. I have a
I always
thought
have
here.
to film tall ways.
Yeah, I'm using headphones, so I've got the little headphone jack thingy. Let's see.
Oh.
Yeah. You know what? I can just hold it. I'll just hold it.
Okay.
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 There we go. I'll just hold it.
Thank you.
Okay, you're welcome.
I have this tripod and I have to like switch it to the side funky and like really tighten it down because it does not want to be this way. Because I always plug my phone in when I do these too, and so I feel you on the headphones jack problem.
Yeah. You know, technology problems. We always have them.
Seriously, and especially with Instagram Live. I mean, there's always something every single time I've done one, so we'll just see. We'll see how this goes.
Yeah, this is a first for me. I haven't really entered the world of living quite yet. So,
I love it.
what do you like
So
most about them?
I like that people can ask questions right here, right now, and we can be responding. I just also like to, like, it's just done. Like, there's no option. Like, you don't have to go through an edit or anything later. It's just kind of like, well, what happened, happened.
Yep.
So,
Live in the moment.
pretty much. So I kind of love it for that reason. So I really appreciate you coming and doing this with me.
Yeah. Thanks for inviting me.
Yeah, of course. So tell us a little bit about functional health and wellness and kind of what you do and how you got into this.
Sure. Yeah. So functional health and wellness is my health coaching business. And unlike other health coaches, I'm actually a functional medicine health coach. And we can talk a little bit about what functional medicine is in a little bit. But essentially, functional medicine seeks to identify the root cause of illness, as opposed to just kind of, treating the symptoms, which the Western allopathic approach does. And I grew up with the Western approach. And really, it was from my own challenges with chronic illness, endometriosis being the first major chronic illness that I experienced that really propelled me to seek different ways of healing. And from that experience, I've had quite a lot of different health challenges that led me to figure out what functional medicine is. And so with my health coaching, I'm really here as an advocate, as kind of a person to walk alongside my clients as they find their voice, as they find what is the best approach for them. So just because I'm a functional health coach doesn't mean that the clients that I work with see only functional doctors. A majority of them do, but there's also many people that are just interested in, alternative ways of healing and, holistic approaches. And so I really just seek to empower the women mostly that I work with. I do work with men, but mostly women, to be advocates for their health and to be open to trying alternative approaches to healing, first and foremost through nutrition, and also health and lifestyle changes, developing a relationship to stress, developing a relationship to just understanding the stresses in our lives and how that really impacts our ability to heal. And so
Totally.
I really consider myself, I'm not like a certified holistic coach, but with my PhD and with my background in transpersonal psychology, really seek to see the whole person and to do that from a very holistic way.
Totally. You almost sound like a chronic illness doula.
Oh, I really like that.
Like you're well educated in this and you're able to advocate for them and support them through what they're going through. It reminds me so much of being a birth doula.
Yeah. Well, what's really interesting when you say that, so this is just kind of a part of my professional experience. So before I kind of found myself as a health coach, I worked mostly with children who were at the end of their life. And so I used kind of therapeutic play. I was a doula of sorts for children and their families at the end of life. Yeah. And so it's almost like this really beautiful transition that's taking place that I'm kind of, not just at the end of life, but in, the life itself and helping people to find their wellness and to find their passion and to find their health when they're as healthy as they can be. So I like that, the health and wellness doula.
Totally. Well, I can't remember. I was watching some show and the woman on it had cancer and she'd hired a health coach to kind of be with her through her treatments and also just be another person asking questions and stuff. And I was like, oh my goodness, she's a doula. And so, when you're describing this, I'm like, yep, this totally sounds like kind of that role that, advocate and support. And, when something's happening to you, it's so hard to always to know what questions to ask or who to go see or what help to get. So I feel like a health coach would be wonderful, going through some of this stuff and kind of having that support and help and a backboard almost.
Yes, absolutely. And that's really where I see myself as an advocate and helping other people to learn how to advocate. And exactly what you said, even just knowing what kind of questions to ask, it can make the difference it's such a huge difference between, finding optimal health or continuing to be very challenged with pain and the various, symptoms that people experience. And, that was very much my personal experience with endometriosis, is that I didn't know what to ask or who to ask, or even when I did work up the courage to ask things, the type of responses I would get would be so demoralizing and would really take away what power I had tried to build up, until it got to such like a boiling point that I was like, well, damn, I've got to figure out how to keep asking these same questions over and over until I find someone that's going to listen to me.
Totally. I'm just so frustrated with so many of these specifically female diseases that we're seeing that are so easily disregarded. And particularly in regards to how painful they really can be, where it's like, oh, well, it just shouldn't be that painful. Or let's just put you on birth control, or and we'll just see if we can just, not deal with that, And so I'm reading Sweetening the Pill right now. I don't know if you've read that.
Oh, I haven't.
Oh, it's so good. So it's about hormonal birth control and stuff. And I went in with ovarian cysts at 18 and they just said, oh, here, take this pill. There was no one, I didn't even have a pelvic exam. didn't even, I mean, nothing. Like they just were like, here you go, and just started me on birth control. And I was just kind of like, oh, okay. And looking back now, and especially reading that book, it just horrifies me because I'm like, what were they? No, it's so frustrating. I think a lot of women run into this same type of frustration when it comes to endometriosis. I don't know that there's a really clean cut path to like this will fix it. And so I do think alternative medicine is a really good, place to kind of start in terms of treatment. So, and for anybody who's watching, March is Endometriosis Awareness Month. And so that is one of the reasons I was so excited Korie could come talk about it, because she kind of has some expertise in this. So tell me about your personal journey with endometriosis. What symptoms did you have? When did you start to realize that's what it was?
Sure. So when I was growing up as a young girl, my mother, with her best intentions, tried to prepare me for what menstruation would feel like. And what she reported was she was very fearful that I would experience what she experienced, which was debilitating pain. So I was actually very anxious to get my period and to figure out, like, what is this whole thing going to feel like? And so at the age of 12, when I did have my first period, it was normal pain. As you know, and I kind of put that in quotes, it wasn't too painful. I took an Advil. I was still active. I still went to gym class and everything. But about the time that I was 13, so only, 12 months after, I was in debilitating pain, not being able to attend classes, throwing up in the fetal position every single month for 7 to 10 days. And so at that point, my mom brought me to my pediatrician, who was pretty much like, okay, we're not really sure what this is, but let's put her on birth control. So at 13, I was put on birth control. I probably cycled through about 10 or 12 different types of it because I would have side effects, but what it was supposed to do was help decrease my pain. So on the one hand, it decreased my pain because it stopped my periods.
Yeah, it puts your ovaries at rest. You're no longer truly menstruating. A lot of people don't realize that, but when you're on hormonal birth control, that bleeding that you're doing is not a real period.
Mm-hmm. And so, on the one hand, I was grateful because I was like, and at 13, we didn't really have any kind of women's health classes, and I knew so little about the whole purpose of bleeding and like what is this, and so on the one hand it helped the pain, but on the other hand I had a ton of side effects, cystic acne and horrible mood swings, which at the time everyone was like, oh, it's just adolescence. And so, fast forward to my late teens, early 20s, the birth control method wasn't working as well. And so we decided to do continuous birth control to completely suppress my period so that I wouldn't bleed. Yeah. And so that happened around 20. So simultaneous to that, I had all these other symptoms, which, I just kind of thought, everyone has their issues. I would have a lot of gastrointestinal challenges, problems digesting food, lots of bloating. I would get sick all the time. I would have sinus infections and bronchitis and just allergic reactions. I was just really sick. And so in my 20s, I started to just be curious, like, I wonder if all these things are connected. And every gynecologist I went to would say, these aren't connected. The pain is in your head. One of the more interesting things that I had heard was that you have a low pain threshold. So, again, I was also told, just wait till you have kids. Having a child, like, that'll help.
What is this phrase? Just wait. Like, why?
Yeah.
No.
Yeah. Well, and I had one female gynecologist say, if you think this pain is bad, just wait until you have kids. Like, as
I
somehow
don't
trying to
understand this.
compare. Or,
Well, and I'm really grateful. I feel like we're coming out of this phase of weird competition amongst women. I feel like we're building more of a sisterhood. I hope we're getting out of this. I don't understand it. I don't get it. Like I hate talking like female OBs sometimes will get really obstetricians will get this same way. Like they're on some power trip and I don't get it. That we're not trying to compete here for who's the strongest woman. We all just
mhm.
want to make it. Why? Oh, I can't. It drives me crazy. Anyway,
Yeah.
continue.
Well,
Sorry.
and as a early 20 something who is trying to navigate this, by myself, I was away at college and just hearing all these
Yeah.
messages, I really did start to think, well, maybe this is in my head. Like, maybe, this is just what normal people feel, because everyone always complains about like cramps. So I was like, maybe I really
Yeah.
just have regular cramps. But
Yeah.
then as time went on, it became very, very clear that this wasn't just pain at my period. This was pain 24/7. This was pain with sex. This was hip pain that was almost like inside of my sacral area that like shot up my spine and into my head. Like all these just, random pains and aches and everything that would come not just with my period, but most of the time. So I found a gynecologist that specialized in women's health challenges, and she said, I think you have endometriosis. Let me send you to a specialist. And that was at 25. And at 26, I had my first endometriosis surgery and was officially diagnosed with stage 4 endometriosis.
Oh.
And so at that time, that surgeon, who was, an expert, was also a very Western mainstream expert. And so, his approach, as soon as I had surgery, like a week after, was let's place an IUD so that we can stop your periods indefinitely in case you still have pain. So I'm like, that's what
They don't always stop your periods indefinitely though. I mean that I don't know. Okay, so for anybody who is watching or will watch this later who does not know what endometriosis is, will you explain really quick what it is and, symptoms wise?
Sure. So that's actually a very complicated question. That's one of the challenges that we're at right now is that the Western approach says endometriosis is tissue that has grown outside of the uterus kind of rampantly, right? But what we understand from a holistic perspective, and I want to show you this book really is
Yeah.
absolutely amazing. So it's called Stop Endometriosis and Pelvic Pain, and it's written by my second surgeon, Dr. Andrew Cook.
That's
And
so awesome.
it's absolutely amazing. And there's a part of the book that I also just want to read a sentence of that kind of gives you a little bit more of a perspective of endometriosis. So how
Okay.
Dr. Cook has understood it is as a syndrome that's defined as a collection of signs and symptoms known to frequently appear together that he has termed MSDS, or multi-system dysfunction syndrome, because endometriosis isn't just painful periods. Yes, there
Yeah.
is a tissue that is endometrial-like. It's not actually just the inside of the uterus that grows outside. They don't really know what it is, and they don't really know where it comes from. But
And it
it's,
burrows, right? I mean, it really attaches
yes,
itself to whatever it's getting into.
yeah, exactly. And because of that, it's found and has been found in every single organ of the body, including the brain, including the lungs. The brain endometriosis is very, very rare, as is the lungs, but it can cause life-threatening issues. And
That's
so
crazy.
what happens is that endometrial tissue, it creates implants, which are very, very deep in nature. And so because of that, you start getting the tissue adhering to different parts of your body. So
Hmm.
my endometriosis adhered to my bowels. And so that was a part of the gastrointestinal challenges I had with constipation and not being able to eliminate, is that it was adhered to my sacral wall. So the tissue
Hmm.
itself had kind of like created this cavity and pushed my organs where they shouldn't be.
That's crazy. That's the more I've grown to understand about endometriosis, it's so interesting and horrifying, but so crazy.
Absolutely. We could talk for hours just about different theories and where those theories have come from and where we're going to. And there's been some really
Yeah.
fascinating research from the functional approach because a lot of women that have endometriosis also have concurrent autoimmune conditions like celiac or lupus or multiple sclerosis or other autoimmune like conditions. And so there's been some
Hmm.
research to really kind of link endometriosis as an autoimmune condition. But from a functional
Hmm.
medicine approach, where do autoimmune conditions stem from? They stem from the gut and from having a leaky gut, right? And then we can get into like this whole other conversation about what that is and how that impacts,
And what causes it, and what are we doing environmentally or, dietarily? What's causing those problems? Yeah,
yeah, it's a
totally.
rabbit hole.
Oh yeah, yeah, for sure. So, what would you say? So painful periods is probably the biggest red flag.
Hmm.
You're saying irritated gastrointestinal was a red
Hmm.
flag for you.
Hmm.
What else do you feel like tipped you off or tipped off your doctor to like so it was surgery that was finally like, okay, we can diagnose her with endometriosis.
So when I saw the gynecologist that was a specialist, she was really concerned because I was having just a regular pap and I was
Mhm.
in excruciating pain just from the I'm not going
Wow.
to use the right term, but like the what is that device?
Speculum.
Yes, like this
Speculum.
thing,
Mhm.
the speculum.
That.
That. And so she was like, this really isn't, we don't see this that often. And so we would like to send you to a specialist. And so that really linked up with pain with sex. And so
Hmm.
when sex became painful, that was also another red flag to me. Like there's something isn't right. Like something just is not working. And then on top of that, right, then there was the chronic pelvic pain. So pain
Yeah.
without my periods that was excruciating.
So we have someone asking, how do you recommend approaching your OBGYN about endometriosis?
That's a great question. I think it really goes back to what we were talking about at first with oh, did I lose you?
Just for a second.
Oh, okay.
So
Ooh, there we go. Technology.
you should, we should, yeah, I know.
Okay. All right, so we're back.
Yes, for the most part.
Okay. Oh boy. You know what? Let me see if I can move my phone here. Um, Sometimes the
Okay.
connection works like
I'm telling you, every
what
single
should we
time there's always a little glitch here or there. Like it happens.
all right. So I'll answer the
Okay,
question and we'll
I can
see
hear you.
how the technology works.
Okay. Oh, you guys, I hope I don't lose her. I don't want to.
Yes.
Okay. Are you back? Maybe?
Okay. Yeah, we'll try.
Okay.
So there we
Okay.
go.
Approaching
Um,
your OBGYN.
yes, approaching your OBGYN. I think it goes back to learning how to be a fierce advocate and asking questions that really seek to understand if your OBGYN or if your gynecologist understands endometriosis. And if you get an answer, and here's the part about being an advocate, we know our body's the best, hands down,
Yeah.
period. If you think there is something wrong, if you have read the books, if you've looked at all the signs and symptoms and you're like, yep, like that is me to a T. And if you ask questions to your gynecologist and they come back with, you don't have that, or they come back with, you're too young, or they come back with, you have a low pain threshold, or my favorite, that's a really rare condition, which is not. It's one of the most common women's health conditions that exist. Find yourself another gynecologist and keep asking.
Yeah.
But some of the ways that I was able to kind of tell if this was a doctor that was right for me was asking what kind of experience they have treating people with endometriosis. What kind of signs and symptoms have they seen in their patients that help them to understand if this was, what was a thing that they worked with. So I think,
Totally.
yeah, I think that even just asking those few questions, like what experience do you have with endometriosis? Based on what I come to you with and my signs and symptoms, what do you think? And we definitely know in our guts when something is wrong. Now, I will also say that there are plenty of other conditions which can mimic endometriosis, one of which is adenomyosis. So, if you have endometriosis or if you have another kind of pelvic health condition, regardless, your doctor should listen to you and should take you seriously.
Well, I'm just thinking like PCOS, similar, can have very similar symptoms, pelvic inflammatory disease, even some of the STDs. I'm trying to think, there's one that's particularly, I might be thinking of just pelvic inflammatory, but a lot of those can kind of mimic these symptoms, but then they kind of have their own too, So that's why it is. It's important too to ask your OBGYN, do you do a lot of this stuff? Because if you're going in an obstetrician who's like, really, I really just like to deliver babies, maybe go see someone that has a little bit more experience in gynecology.
Exactly.
So I'm with you. I think it's so important because I feel like doctors, they specialize. They have stuff that they love to do. You will find someone who's like, no, I'm an advocate for endometriosis. I want to treat endometriosis. That is something I know. But that's the doctor you want to find, like you said. And that goes for any women's health condition.
Yes.
You want to go find someone. And it might be too, I know you'd have to escalate to an OB or a GYN for endometriosis, but I know a lot of nurse practitioners that they actually handle a lot more of the gynecology than the OBs in their office does. So maybe you're establishing with their nurse practitioner, instead of, so yeah, ask questions.
Absolutely. And if you have the resources, I think it really depends. Like, do you live in a big city? Like I had the luxury of living in Queens, and I had Manhattan at my doorstep, and one of the best kind of Western surgeons for endometriosis that I could go to, and that was a referral. But if you live in a very rural community, you might not have that luxury of being able to just, choose another gynecologist. So I think in cases like that too, really creating a relationship and a dialogue with your gynecologist that you can come back the next time with some literature. You can bring the book with you. You can even, there's this other great book, and it was also written with with a health coach in my surgeon's book. So this is the book, The Endo Patient Survival Guide, which has some really great tips, specific questions to ask your doctor too.
Awesome. That's perfect.
Yeah.
Well, and tell us, is this something that women could reach out to you for support, in a long distance way? Is that something that you do?
Absolutely. I would say that the majority of the work I do is on, with technology, with the glitches and all.
Yeah.
And sometimes, yeah, and sometimes just like good old telephone coaching, I'll pick up the phone and have just, phone conversations with clients. But absolutely, I really consider myself not just a health and wellness coach, but an advocate and an activist. And so, you know, if someone just wants information or if they want to have a consultation to work one-to-one, I'm happy to be a resource.
Okay, that's so good to know. So one of the things that I asked you, so I emailed her, we kind of talked a little bit beforehand. I'm going to actually put these questions up on my blog. But I said, what would you recommend to women that are suffering from this condition? I feel like this is kind of a good way to kind of wrap this up. But what steps, you know, and we've talked about some of these, but I would love if you'd kind of, you know, review and wrap up, like what, for those out there that have endometriosis, what do you recommend, you know, from your standpoint?
Sure. So if you're a woman out there and you know that you have endometriosis, I think that, you know, because it's a systemic and it's a whole person condition, you need to have a whole person response to that. So on the one hand, having, you know, gold standard wide excision surgery will give you the best chance of being pain-free indefinitely. But that is also a financial luxury. I had to have a GoFundMe account and pay totally out of pocket for my second surgery, which was excision, but it was successful. And so it's one of those things that if you have the financial resources, I would say hands down, 100%, get yourself to an excision surgeon who specializes in the deep extraction of endometriosis. Because that's one of the other challenges is that I know women out there that have had 10, 15, 20 surgeries. And it's the same type of surgery where they just burn off the surface of the endo. They don't go into the tissue to remove clear margins. So that's kind of the first thing.
So I just had what was recovery like after that? And I mean, because that seems like it would be a fairly extensive
It was
surgery.
Intense. That's the other thing, that the first surgery I had, I was up and I was walking and back to work in 2 weeks tops.
Yeah.
You know, I took a few extra days. But with excision, because it's invasive, and they have to be aggressive to be able to get all of the diseased tissue.
Yeah, you want it gone. Yeah, if they're going to go in and do it, yeah.
Yeah, so my first surgery was 2 hours. You know, I was this surgery was, I think it was 4 or 4.5 or something like that. I had a hospital stay overnight, and then it took me a good 6 months until I was like maybe 75%. Like I wasn't prepared for the intensity of the recovery. So that's another thing that I would very much advocate, that if you're a woman out there and you're considering excision surgery, please, please, please reach out to me or reach out to another person who's gone through it, so that you can prepare yourself for the healing process that will take place after. So outside of surgery, there are a whole host of other things that women can do that they're not going to make your pain disappear. They're not going to make the symptoms disappear, but they might give you back a much more, a better quality of life, decrease pain. You know, living with chronic pain, I feel like, you know, for myself, I had a good pain day if my pain was less than a 4. And so that's what I worked at, was getting my pain consistently less than 4. And so doing a whole host of things. The biggest thing that I did that had the most impact was changing my diet. I definitely took out gluten and dairy. Those are the 2 biggest culprits, and sugar, which is my arch nemesis. And I still have a challenge doing, as my husband can attest to. Just a little
It's
bit.
hard. It's a very addictive drug.
It really is. It really is. But, you know, when you look at endometriosis as a systemic condition, one that is fed by inflammation, the best thing that you can do is decrease your body's ability to be inflamed. And one of the biggest culprits of that is sugar. So if I had a client that's like, I can't do the elimination diet, I can't cut out all these things, what's one thing I can cut out? Sugar.
Yeah.
Yep.
It's just not, it's so funny. Every single fad diet, every single everything can all at least agree we really shouldn't be eating as much sugar as we are. It's not good for you. It's so frustrating, but
I
it's
know.
not
And
good
it's
for
in
you.
everything. It's in
It's in
everything.
everything. Yeah. I could go on for days about that.
Yeah.
Anyway, hey,
Yeah.
yes.
But from an inflammatory perspective, and also, looking at this from the functional approach and with a big focus on gut health, understanding that if you do have a leaky gut or if you do have food intolerances or food allergies, you've got to get those out of your diet to help restore and repair the guts. And so for myself, at this point, I'm gluten-free and dairy-free, corn-free, like 99% soy-free. I still like tofu, but I'm fairly sugar-free, but and it's
Yeah.
also it's about balance. It's not about depriving
Oh,
yourself.
totally.
It's about finding out what works, and how to do it as often as you can.
Well, it's a lifestyle change, and I think when it's for your health, when you know that it's going to remove this pain, it's just so different than a diet.
Absolutely.
It's a totally different thing. So,
Yeah, yeah.
yeah,
And that's how I approached it too, is I never thought of it as a diet. It's like I have to change my lifestyle to learn how to live and cope with this pain that I'm experiencing. And so
yeah,
on top of that, I also had to like build a very extensive like health and wellness team, so to speak. And
yeah,
so, understanding that chronic pain really impacts mood, I had to find a really good
totally.
therapist. Right.
Yeah,
So I've worked with dozens of therapists, all different types and modalities. And, I say, find a therapist that works for you. There are different
yeah,
types of therapies out there. And so it took me some time to find someone that really understood chronic pain and also understood endometriosis. But when
yeah.
I found her, I was really grateful. Also, acupuncture was so helpful for me.
Really?
I would say that was, whether it was like supplements or biofeedback. I did biofeedback. I saw a naturopath. I did massage. I did pelvic floor massage. The
Mm,
acupuncturist, hands down, was the one practitioner that like I would go in with like pain 8 out of 10, and I would leave pain 6 out of 10.
that's amazing. That's awesome.
Yeah. So I think it just really depends on, what kind of resources you have, what kind of access you have, and how open you are to maybe trying things that are maybe a little outside of the box, that you
Yeah,
wouldn't necessarily do on a day-to-day basis, and really just having an open heart and an open mind that healing
yeah,
can happen, um, and that you're doing this so that you can live as healthy of and pain and less pain as you can.
yes, definitely. Awesome. Okay, well, I really, really appreciate you. Is there anything else that you want to cover while we're here?
We covered a lot. We definitely covered a
Yeah,
lot.
we did.
We could continue to talk for hours on end about
We really
so
could,
many
though.
topics. Just a quick little shout out. So later this week on my Instagram, some of these books like the Endopatient Survival Guide and Stop Endometriosis and Pelvic Pain, I'm going to be doing some giveaways to give
Awesome.
these away. So,
Okay.
if you're watching or if you watch this later and you're interested, just follow me and wait for the post later on in the week. You can
Okay.
definitely reach out to me, my website and my business. I'm on Facebook and Instagram, got a website, all that good stuff. And I'm
Awesome.
happy to support, anybody, and also, partners too. And that's one thing we didn't really get a chance
Yeah.
to talk about, but this really impacts the people that you love, whatever kind of partnership you're in. And even if you aren't in a partnership, and just your family and your loved ones and your friends. And
Yeah.
so I'm happy to be a resource for anyone who is dealing with endometriosis.
That's awesome. Thank you so much again. You guys go check out Korie at Functional Health and Wellness. That's her Instagram handle. And thank you. This was awesome. So if you
Yeah.
guys have any additional questions, I am going to post so much of what we covered on a post up on my blog tomorrow. This live will be available for 24 hours, but feel free to message me or Korie, and we'll see what we can do at getting your questions answered. So
Yeah.
thank you so much.
Yeah, you're very welcome. And thank you for all the wonderful work that you're doing out there. It's so
I
important that
love it.
we have voices like yours that will help to demystify and just, advocate for life and for women's lives.
Yes. Well, women's health, I'm really passionate about it. So I'm here. I'm here and happy to talk about vaginas all day long.
Yes.
Anyway. Okay. Well, thank you so much. Have a good night.
Yeah, you too. Bye.
Bye.